Nowadays, we can identify people early. We can reconstitute their immune system so they get out of the risk of AIDS-defining conditions. I think, somebody in care should pretty much almost always be able to achieve that outcome. So most of the time now we're in this era, as we said, of trying to define and treat non-AIDS defining illnesses. And so there's a definition of these chronic comorbidities that are associated with HIV. And sort of a working diagnosis would be a chronic condition developed during HIV infection, related or unrelated to HIV pathogenesis, which can affect the clinical course, treatment, prognosis, or quality of life of the patient. And in the little diagram on the bottom, you can see there's traditional risk factors for cardiovascular disease in this case, so being overweight, sedentary, dyslipidemia, diabetes, smoking. And then there's some things associated with being HIV, a person with HIV may be higher risk for injection drug use, antiviral toxicity, especially the older drugs that cause mitochondrial disease or drugs that elevate the lipids or increased weight, which we're seeing now with integrase inhibitors. And then chronic comorbidities, co-infections like cytomegalovirus and herpes virus, things that could reactivate and cause additional immune stimulation, could all contribute to the shift toward higher risk of comorbidity and cardiovascular disease. And then you can see that manifest in the final diagram, where there's a higher rate for myocardial infarction in this case of people aging as the years go up, and the lines split even more, with HIV getting more risk for myocardial infarction than HIV uninfected persons at each age group. So these are all the multiple factors that can feed into this ultimate outcome. And breaking it down again even further, HIV-associated factors, lifestyle, maybe more risk for smoking, substance use, social isolation for sure due to stigmatization, chemsex, having sex associated with substances, HIV treatment effects, polypharmacy, not only to treat HIV, but these other comorbidities. It becomes sort of a cycle where you end up on multiple medications because not only of HIV, but this increased risk of comorbidity. Drug and drug interactions many times can be overlooked, especially if there are multiple prescribers that are giving medication, or even over-the-counter medications can interact sometimes. Certain drug toxicities related to lipids and weight gain and other things could be appropriate, important issues, or putting people at risk for falls if it makes them a little bit drowsy, especially as we age. Residual viremia, of course, could be feeding immune activation. There's this new term called inflammaging, linking inflammation and aging together. And this will also be relevant when we talk about the oral health issues. Immunosenescence, the aging of the immune system, which starts really from birth, and especially the thymus is involuted by the second decade. So we are aging, our immune system is maybe aging differently than we are. And the altered microbiome, which we're sort of trying to understand, and we know that a microbiome has a lot of implications on the balance of our immune system and our health overall, but we don't really know how to measure that or how to perturb it in any way. We just want to try to prevent things like excessive use of antibiotics that could affect the microbiome in a negative way. The hypercoagulable state of HIV certainly could lead to increased cardiovascular risk, absolutely. Chronic co-infections, things that are maybe more likely to be chronic or reactivate in people with HIV, chronic hepatitis C, cytomegalovirus, HPV, associated with lots of dysplasia and cancers. Epstein-Barr virus, we still need to learn more about it. Sexually transmitted infections, and any residual low-level HIV replication that could be stimulating immune activation. So all this feeds into increased risk for certain conditions. And on the top, you can see the ones that are most related are infection-related cancers, like cancer associated with hepatitis C, hepatitis B, HPV, lung cancer, COPD, cardiovascular disease, kidney disease, much higher rates with HIV, neurocognitive disorders, HIV-associated neurocognitive disorders, and others. osteoporosis, sarcopenia, frailty, fracture risk, etc. All these things are more associated with HIV and aging. And other things like developing cataracts, macular degeneration, colorectal cancer, breast cancer, prostate cancer, melanoma, etc., are not really related to these factors.